And so I was diagnosed and underwent a bypass surgery when I was a freshman in college, and unfortunately had strokes and complications from the procedure. And so we actually spent a lot of time when I was in college. I was both studying for medical school and helping my family take care of him at home. And I think that experience alone, I think at a young age, really kind of shapes you.
Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. I am excited to be sitting here today with the wonderful Jana Goldberg. Jana is the Chief Medical Officer of a company called Heartbeat Health. Jana and I have been communicating for quite a while, trying to make this happen. So I'm so glad we finally could sit down. Jana, thank you so much for joining us today.
Well, it's so good to meet you. Thank you for having me.
Pleasure. So let's jump right in. Talk to us a little bit, just briefly, about where you grew up and how you got involved in healthcare, why you decided to take that path.
Yeah, sure. So I grew up youngest of three, couple older brothers. My parents were both immigrants, both from the Czech Republic, and both in medicine. My mom, when she very early on when I was a baby, she was one of the first women in interventional cardiology down in Atlanta, and so I had really early exposure to someone who was just kind of dedicated to the field from a very young age. My dad spent most of his career, was a little older, spent most of his career doing head and neck reconstructive surgery before I was born, before he got married. And when I was a kid, maybe it's being the last child, spent a lot of time kind of just thinking creatively and imagining. And my dad was in particular just amazing at really nurturing that. If I had an idea, he would run with it. I got really interested in space, and so he wrote a letter to NASA. I got interested in design and drawing, and so he tried getting me into college classes when I was 13 years old. And he was just a really fantastic facilitator of that. And I didn't quite recognize it, I think, when I was that young. But it's certainly recognized later on. He got really sick when I was in college. I spent a lot of college taking care of him at home with my family. He had coronary artery disease, and so was diagnosed and underwent a bypass surgery when I was a freshman in college, and unfortunately had strokes and complications from the procedure. And so we actually spent a lot of time when I was in college. I was both studying for medical school and helping my family take care of him at home. And I think that experience alone, I think at a young age, really kind of shapes you. And ultimately, I think kind of my worlds collided. I think I ended up going to medicine. I was super passionate about it, um, and certainly had some exposure from them, but also I think really early on just kind of understood, the hardships that families go through when their family members are ill. And so that was, for me, really shaped me, early on. Ultimately, I went to medical school. I went through training, ended up in cardiology, and um, found my way to exercise and wearables very early on. Got interested in kind of working outside the box, using devices out there to leverage for data, incorporate exercise into my patients' care plans, and then found my way to Heartbeat, where I am today.
Wow, that is quite the origin story. It sounds like you had both sides of inspiration from healthcare. Sounds like you had a beautiful experience watching your parents' involvement and passion for the space. But then it sounds like you also saw some of the the gaps and the hardships and the challenges around healthcare when dealing with your father's care. Is that the case? Like, what was there certain realizations that you had while helping to take care of him that you were like, the system is broken?
Yeah, absolutely. I remember this one day. I was a freshman in college, and my roommate had asked me, "What is your favorite day of the week?" And my response was Monday. And she kind of laughed at the time, but I say that because what was happening was on the weekends I went home and helped my mom, helped my brother take care of my dad, which was just when someone has complications of a stroke, it is anywhere from helping them eat, helping bathe, and that's something that's really traumatic, I think, as a young kid. And I think like we were really fortunate and we had resources, and even with those resources, like as a family, that was a really hard struggle at the time. And I think so very early on, I started to appreciate that, like if that's what I'm going through, like what are others going through? And it really started to understand that despite the amount of support out there, that families who are going through this with their own loved ones, that they are not necessarily getting nearly the support that they should. So it really creates an imprint on you as a kid.
Yeah. And kind of jumping to the present for a minute, do you f- how do you feel the system has maybe evolved, or maybe it stayed stagnant? And how has that kind of informed some of your work at Heartbeat Health? We'll jump back to the origin of Heartbeat, but
Yeah, I think in a really good way. I think the healthcare system has recognized that there are other options besides just the traditional routes of care that were the case, you know, you decades ago, when I went through that. I think that having options for patients for more support, making visits easier, telehealth in general, right? Like over the last few years, people start to actually appreciate the value in that. And, going back when you are a like family member and you have to go through all the motions of getting your parent or your loved one like out the door into appointment, which could have happened via televisit, or gotten information to their care team that could have happened remotely. I think little things like that start to fit together in a really kind of beautiful story that is today, which is the recognition that we can do things differently. And although it's not necessarily going to solve all of our problems, right? Like families are still going to struggle um, with events like that happen. We can make things just a little bit better, which maybe makes their days just a little bit better than they otherwise would have been.
yeah, yeah, I love that. No, it's hard enough, obviously, for a family member to actually deal with the reality of sickness and illness. And the least that the system can hope to accomplish is to at least not add additional stress and chaos through, you know, unnecessary, burdensome workflows. And yeah, I agree with you 100%. So sounds like you got to Heartbeat pretty quickly after medical school. What is Heartbeat Health?
Yeah, so I started with Heartbeat. I was on faculty. I was out of training for a few years before finding Heartbeat. At Heartbeat Health, we are a virtual first cardiology practice. So we are a clinical group at our core, and mainly focused in cardiology, which means that we have a team of specialists, of cardiologists, both physicians and advanced practitioners and nurses and medical assistants that deliver cardiology care. And that really ranges from kind of a couple large buckets. One, diagnostic services. So as our within our wheelhouse as cardiologists, we can perform tests like EKGs and EKG monitors, echoes, which are ultrasounds of the heart. We can bring those into settings that don't necessarily have them, or bring them into the patient's home when they otherwise wouldn't have had that opportunity, and help support new programs like that. On the other side, we also do patient care, right? As cardiologists, we can care for a patient really in a really comprehensive manage or way. that is anywhere from very lightweight care to longitudinal care of complex heart failure patients, for instance, where we are seeing them every week, every 2 weeks, every month. We are watching their vital signs every day. We are, doing visits with them, involving their caregivers and family members. We are adding on medical therapy. We are titrating medical therapy. So when you are able to kind of pull together a clinical group like this and scale nationally, which is what we've done, you can really start to bring care to areas, to groups that don't have it, not necessarily rural, a lot of urban settings too. As we know, there's a lot of care to go around. And so we've really been able to effectively do this and help support a lot of patients.
Hmm. And are you guys, I know you talk about value-based care a lot. Is this in a value-based care setting or fee-for-service setting or both?
Yeah, so we are in both settings, but one thing that has really evolved over the last few years is our presence in the value-based care setting. And so that is a very big focus of ours right now. The beauty of being a specialty group in the value-based care setting is that you can take a primary care organization, you can align with what their mission is and become really an adjunct to their care. And so we can shift care upstream. We can bring in diagnostic programs to primary care clinics that otherwise don't wouldn't have had them. We can start those programs. We can interpret, diagnostic tests that happen, and then we can actually care for their patients too. There was some really nice data that came out a few years ago looking at the efficacy of some of the value-based care programs out there. And one thing is becoming increasingly clear that primary care physicians, clinicians as a group are doing so much right now. They have the world on their shoulders. They are trying to move mountains caring for their patients. But in order to be s- the most effective, they really need good partners to help support them. And that means making it easier to get testing when patients need testing, supporting them, even in a lightweight manner. Maybe a patient, has a maybe mild abnormality on a test and they don't necessarily have to go to cardiology, but can we help support them in a really lightweight way to then give the PCP group some direction on what to do? And if that patient becomes sicker, then we can see them. Or for their really sick patients, those that are high healthcare utilizers and in and out of the hospital, can we become an adjunct, an additional resource to see that patient, to get them on really good guideline directed therapy and keep them out of the hospital? And so it has been virtual first care has been a really, I think, beautiful adjunct to the value based care setting. And I don't see that going away. And I see it only growing more as more patients and organizations grow in the space.
Yeah, and I love the term virtual first, not just a virtual setting, because it takes into consideration the fact that that's not, not there's not one size fits all when it comes to healthcare, and trying to be efficient in mindset about what you can move virtually is obviously necessary. Um, but I love the concept of a virtual first. But let's double click on that relationship a little bit, because I agree with you. From talking to a lot of different people, it seems like one of the main reasons why the role of the primary care provider has kind of evolved and changed over the last 50 years or so really has to do with the incredible increase um, in sciences and medicine that we've had as a country and as a society. And we've learned so much that it's simply impossible for the PCP to keep on top of everything. And that's why, to your point, it seems like it is so important for the primary care to for the primary care provider to really have those good relationships with specialists that they can lean on. But obviously, what that comes to is, well, the downside to that could be um, adding to the fragmented nature of healthcare and a patient feeling like they're given the runaround and who do I talk to, or I'm talking to everybody and giving everybody the same thing. And so, how does Heartbeat Health go about that relationship? What does that kind of connection look like? And as far as the relationship, both for the provider and the patient?
Yeah, really good question. Honestly, I think the key has been create and nurture that PCP home of the patient, nurture that relationship, and keep the PCP and the patient at the core. So, if for instance, if we are working with a primary care group, that primary care provider, maybe they've been able to care for the patient up until a certain extent, but then say that patient has, heart disease, say they need additional support. um, Being able to, one, make it easy for the PCPs, so really work within their workflows and not have them necessarily jump through the hoops in order to kind of get that patient to the cardiologist. So first, like, you have to make it easy for the PCPs, and support staff in the clinic, to make it easy for the patient. So whether or not it's facilitating the virtual visits. So there's all this, there's a lot of literature in increasing the digital divide with telehealth, and there are certain ways to do it that you don't exacerbate that divide. For our patients in particular, especially in the value-based care setting, we have to make virtual first care easy, which means if it's just a link that the patient clicks on, no app download, at that, like, that may be the best, path to that patient. If they don't have a smartphone, then stand up a telehealth room and allow that patient to have a visit with their PCP and then walk down the hallway to have a visit with their cardiologist. That is, not necessarily a separate entity, but part of that their PCP group. So make it as easy as possible for the patient provider, and make them feel and know that you are part of that group. You are part of the mission. You hear them, you understand their goals of care, and communicate. So if it's a matter of getting on the phone with the PCP and having that two-way dialogue to ensure that what we are doing for the patient is the right thing, that just goes miles for that patient. So it's all about making it easy for patients, providers, and keeping that PCP home the center of that patient's care.
So, am I hearing that you guys have physical centers where patient can see their Heartbeat Health cardiologist, and then you have like a little pods for telehealth with their PCP? Let's double click on that. Talk to me about that experience.
Yeah, so we are truly hybrid. So we not only kind of do visits in the virtual setting, but we kind of work within PCP's walls as well. And that could be in a couple different ways. One is just bringing in diagnostic programs to the PCP setting. So a patient may say they need an echocardiogram, which is an ultrasound of their heart to understand how strong their heart is. They can walk down the hallway from their PCP to then have an ultrasound performed, which then immediately comes to the cardiologist. And within the hour has an interpretation that gets back to that patient and gets back to that PCP. So you can see how quickly you kind of break down barriers for that patient to get the test done and get them a diagnosis. To actually facilitating on the ground positions, for cardiologists, with our partners, and so that in itself, we become even more and more hybrid. I mean, and we get this question a lot, and uh, virtual first, will solve a lot, but it does not solve everything. And so I think in order to be really successful in the coming years, we have to further embrace hybrid models like that, to really kind of extend our reach, our care to patients, and make it just overall a better experience for them.
I love that. Yeah, I had this idea like 2 years ago, I think, of trying to help solve the gaps in coverage for rural communities. And the idea and the problem is a lot of them just don't have, literally, like, even if you are going to do telehealth, they don't have internet or the bandwidth to actually make that happen. And so I was thinking about drop, the idea of dropping in little just hubs that can connect to various, like it can be like kind of like one hub that connects to various different, you connect to any doctor that will do telehealth essentially. And then all you have on site would be like an MA that can actually like use, like put all the devices on correctly to make sure the readings are done well. So that's all they have to be trained in. Um, so that's where my mind went. So I love that you guys are doing that model. I think that's awesome. Um, let's talk about some care gaps. Obviously, some of the largest, some of the heaviest cost is around is around heart disease in the country. Um, what are some of the main care gaps that you are seeing with patient populations, and how do you guys go about managing those and helping them close?
Yeah. Yeah, I mean, and you said like, I mean, heart disease, despite COVID and everything going on out there, heart disease remains the number one leading cause for death for men and women, and the majority of it is preventable. Um, it when it comes to the gaps, I think about it as a cascade, and think of it as sort of like a staircase of gaps, and so from the time that someone is extremely healthy to the time that they are potentially, advanced disease, super sick, at home getting care, there are several missed opportunities along the way to intervene in that patient's care. And so, in order to be effective, we have to tackle each of those areas of opportunity. And so, think about like if when they were super healthy, the gap is we are failing to recognize and modify the risk factors that are putting them for risk for heart disease down the line. When it comes to them actually developing disease, we are failing to actually diagnose them with the disease at the time that that disease is happening. Second to that, so further on, kind of down that staircase, when they're actually diagnosed, we're failing to provide first line therapy, effective medications that help extend their life, help them feel better. So, if you take heart failure, for example, which in its simplest form is the inability for a patient's heart to function well or pump well. Um, Less than 30% of the patients out there are on maximum guideline therapy. And the fact is that, and why that's important is for every 4 patients that we get on a maximal regimen, we keep one patient out of the hospital. We save one life. It doesn't take, and in medicine, we do a lot of things where it takes a whole lot more people to treat before we actually see an impact like that. Like there are therapies out there that when we can actually deliver them, they save lives. They keep patients out of the hospital. And then moving on in that staircase, we are failing to say we come back to that example of someone who is maybe in hospice care, or maybe they are just in advanced disease. They've been in and out of the hospital and they have vocalized that their goal of care at that point may be being out of the hospital and spending time with their family. We are failing to recognize, align our care plans, and provide that supportive care for patients that need it. And so it's really just these missed opportunities in the cascade of disease evolution that in order to be effective, and this is why I think the value-based care model is so critical here, is we have to think about each of those opportunities and tackle them on each level to be effective.
Yeah, it's wild to me that this is the highest cost, so to speak, and the biggest ROI on preventing it. Like you're describing that you see the quickest and really impactful results from a little bit of preventive treatment. So it's just mind-boggling that this remains the top issue in the country. Why can't why do why aren't we making like serious headway? I mean, obviously heartbeat health is, but uh, what's stopping us? What's wrong with the incentive structure in the system to really make a dent in this issue?
I think it's such a complicated topic. I honestly, I think there's multiple issues. I think where I see the benefit coming from what like we have done, for instance, is helping to provide the care and that is needed for patients at the right place in the right time, make it easy for them, recognize if disease is there, and then be smart about it. Actually, institute protocols that allow for easy addition and titration of drug therapy, for instance, for heart failure, um, and and really just facilitate those next steps for patients. So I think that we had performed a trial that we had presented at the ACC this past March and will be coming out in publication. But essentially, it was a randomized trial. It was the most rigor you can give to a program, and we basically looked at usual care after a patient was discharged from the hospital versus usual care plus our virtual first program, which was a combination of virtual visits and remote patient monitoring for patients who needed it. And during
Post
that
discharge.
what was that?
Post discharge, the program takes effect.
Post-discharge. Yeah, that trial was specifically focused on the post-discharge setting, and through that program, basically seeing the patients frequently, keeping them engaged, getting them on the right therapy, and we saw, 30, 60, 90-day significant reductions in readmission for both cardiac and all-cause hospitalization, and, there's no secret sauce to it. It honestly was really good care, getting care to the patients and getting them on the right medications at the right time and providing the level of engagement needed for those patients. And so that's where I see programs like ours, starting to make a dent in that care.
That's awesome. How many patients are you guys managing? Roughly?
Yeah, so we're in the few hundreds of thousands of now between all of our services. And most of the patients, if in terms of engagement points, typically have at least a monthly engagement. For some patients who say their disease is stable and they are not having any symptoms, they're on good therapy, we stretch that out. So I think a key is it's not a one size fits all approach. You have to adjust your level of care to meet the needs of that patient. Again, with the sort of value based mentality in mind, is give that patient the access, the care they need. And if they need that higher level, provide that higher level of care.
Yeah. So, and that's congratulations, by the way. I mean, to be able to help the lives of hundreds of thousands of patients is a blessing. So that's really incredible. Let's talk about that first step when you talked about the cascading care gaps. What is it would seem to me that the staircase is a result of each earlier step. Meaning, if you don't take care of step one, step two gets bigger, step three gets bigger, et cetera. Um, what are some of those initial, most preventable issues? Like, what are some of those care gaps that are really at that like initial, where somebody's not really sick, they don't technically have to go through a bunch of care, but if they don't do X, Y, Z, then they're going to get there, and things that we could prevent. What are some of those things?
Yeah. So a couple things. One, many of the risk factors that patients have, things that we can modify, overlap with different heart conditions. So the same risk factors that put you at risk for developing a heart attack also put you at risk for developing something like heart failure or atrial fibrillation down the line. And so um, it really comes down to basic risk factors such as hypertension, obesity, tobacco use, as sort of a listing. But in terms of the preventable, really being a couple major ones: coronary disease, so atherosclerosis or plaque burden buildup in the arteries around the heart that predispose you to a heart attack, and heart failure, which is the number one cost driver when it comes to, when we're looking at the total cost of care for cardiac disease. Those are issues that if a patient has long-standing high blood pressure, which we call the silent killer, if someone has long-standing high blood pressure and it's being ignored, or they have potentially really uncontrolled sleep apnea, for instance, or have high cholesterol, those are things that if we can start to recognize and modify and bring light to a patient, we can start to kind of intersect development of diseases like that. Coronary disease in particular, the majority of heart attacks occur in patients who have had no prior symptoms, and so there's a lot of really good data out there looking at patient as a whole, taking all their risk factors and saying, here's your long-term risk. And actually, the American Heart Association is coming out with a new calculator that will be, should be widely used in the coming month, called the Prevent calculator. We should be utilizing risk tools like that. There are other tools out there, some leveraging AI, looking at CT scans of the heart and plaque around the heart to understand, are there particular areas around the heart that are, vulnerable for a heart attack? But really starting to understand, those basic risks, translating it to a patient, even providing some concrete data around that, so patients understand that risk, and can track it and, prevent these issues long term.
Yeah. Let's talk to the patients for a second. What's like some just basic bare things that anybody can do to increase their chances of not ending up in the hospital for these kind of situations. My good friend Dr. John White, Chief Medical Officer of WebMD, he put out a book on this as well, and his number one tip was eat fish. What's Do you have any advice for just the run of the mill person who, yeah, what are some basic things that we could do to better our own health?
Yeah, it comes down to 3 basic things, which are, 1, eat well, so what you put in your body, so making sure you're eating well. A lot of buzz out there about plant-based diets, Mediterranean diets, and there's a lot of good evidence to show that, they cut your risk of long-term risk of heart attack. Exercising, so, we used to try to get our 10,000 steps in. But honestly, any increase in exercise from your baseline is going to minimize your risk of heart attack and increase your risk of living longer, in the long term. And then avoiding bad habits, avoiding smoking, and other bad habits that cause risk. So I'd say those are the 3 major buckets, which is something that our parents are telling us when we're young. Eat your vegetables. Don't engage in bad habits, and get outside and exercise. So honestly, it's basics like that, but also recognizing that some people, there is a genetic component and it runs in families, and if that's the case, go see your doctor and talk about that and understand. You may not have risk factors, but maybe if it runs in your family, there are things that you can do to cut your risk as well.
Yeah, and it's so interesting how it varies person to person, and that there's so much information online, and often misinformation or disinformation around dieting and health, and anyone that's doing the one size fits all kind of thing. It's on a personal level. I've been for the last like 2 months or so. I've been trying to really hone in on what how can like what makes me most efficient from a diet perspective, and so I've been trying like weeks of certain kind of diets, and I did salads for like a week, and I felt horrible, just all around, just terrible. And now I went back to like just eating eating in the middle of the day, like a little bit of meat and eggs, and feel great all around. But I tried a only meat diet like a year ago, and I did for 6 weeks. I ate once a day, and I only ate meat, and I ended up in the ER with a kidney stone. So, so, so it's like now I'm like, okay, so I'm gonna try this again, but I'm gonna drink a lot more water to try to offset that. It's never a one size fits all. It's always a learning process. But um, let's talk about the future. What are your goals with Heartbeat Health? What would you love to see through through as your career continues to evolve with the company?
Yeah. Um, One thing I'm really excited about, honestly, we've been, doing care for so long. One thing that I'm really excited about is starting to see, really our channels, start to come together. So, for instance, if a patient comes to us through a primary care clinic or a home visit, can they also come to us through another setting, through say their local pharmacy or local grocery store? There are ways that we can start to pull everything together in a really easy way for patients, and for the system, because there are like so many point solutions out there that we have to start to kind of bring it together, and also allow for um, different levels of care at different times. So allow for potentially lightweight cardiology care versus more complex care, going to some of our heavy hitters either on the ground or virtual first as well, but allowing for patients to find their way to us with multiple different options, and connect those dots for them. So that's where I see things going over the next few years, and really excited to see it starting to come together.
Well, it definitely does sound exciting, and I wish you tremendous continued success in being a part of the future. And there's a lot of people that love to just whine about the state of healthcare and talk about how bad it is now. All the models aren't going to work and everything's broken. And then there's some people that are trying to be a part of the future. And it looks like you yourself and Heartbeat Health is definitely part of the solution. So thank you so much for that, and excited to watch your continued incredible work.
Thank you.
Well, this was fun. Thank you so much
Yeah,
for joining me.
yeah, no, thank you. Thank you so much for having me. This is fun. It's exciting. Honestly, we yeah, I still have my clinical time. I think every day that we see patients, we see kind of a little microcosm of the bigger picture. And I think it's really exciting to see that come together. It keeps us motivated every day, with kind of what we're doing, but also see where things are going, and ultimately where we can make a difference. So I really appreciate you having me, Mendel.
Absolutely.